Um, Before I start, I just really want to reflect for a moment on the discussions that have happened so far. And I think that um, uh, it's an this is an indication of the way that I work, that we work. Obviously, it's the way that the IOM works. But um, there's so much knowledge out there that we as media producers have to steep ourselves in if we are going to communicate effectively. It's been the way that I've worked my whole career, and I embrace the process, and I think it's important. So the discussions that have the information, the perspective, the generosity that people have with their knowledge and their wisdom and their opinions is something that a healthy America is going to be built from. And you'll hear a little bit more about that. So I just want to thank people for sharing everything that they have so far. I also want to acknowledge that there are members, some of the people you met, but David Britt didn't get a chance to introduce himself, and he's joined us. And David Britt is one of the board members of the Public Good Projects, and he was one of my first sort of high-level bosses in my career when he ran the Children's Television Workshop. And I want to point that out because on the Public Good Projects board, which will continue to grow, we have a group of people who really have an array of perspectives and experiences with creating media, analyzing media, measuring the impact of media, and so it is in the DNA of the company very purposefully. And two people who aren't here now who couldn't join us. One is Phil Marino, who's the chair of the Public Good Projects Board. Phil is the retired president and CEO of Levi Strauss, and prior to that, PepsiCo. He is on the board of Kaiser Permanente. He was on the IOM committee Accelerating Progress in Obesity Prevention, on which both David and Ellen and Tony sat. I think it's important for you to understand that when we talk about a healthy America, and to Megan's point, reinforcing a point that she made, that we are establishing a brand. We're trying to create a level of awareness through many of the techniques of establishing a brand that will be ever present in people's lives and have a set of values that people assign to it, or we help them understand the values that are assigned to it. So to have Phil as being someone who has managed two of the most iconic brands in our culture is a great privilege. But I would say that it's very important to say that the vice chair of the Public Good Projects Board is Ruth Wooden, who was the president of the Advertising Council for 10 years and the president of Public Agenda for 10 years. And so to have in some of our stewardship two people who have led both in the commercial sector and in the public sector the shaping of America's thinking around issues, both understanding how to sell products and how do we apply that to health, and how to sell issues around tobacco control, seatbelt use, and many other issues that Ruth helped to really transform the way that we think and the way that ultimately we behave. So I just want to point out that that's part of who we are. We've put together a series of slides that I'll take you through. I think that if you think about an image like this, that we all hope that in the future, that when we're reading the New York Times, that this will be the headline, that chronic disease drops to 40-year lows. So A Healthy America is a program that aims to be one of the forces in the culture that is driving us to a point where we can wake up and access the New York Times, and this is what we see. So the question we have before us right now at this room that we want to bring you into the conversation on, that we want to establish a dialogue for the long haul with all of you, I'll say, is how do we make such a reality happen? How do we get to a point in a couple of generations where we're seeing a decline rather than an increase in chronic disease rates? So I'm going to take you quickly through just a sketch of what we are looking to do and the resources that have now, with the George Family Foundation and the California Endowment, have helped us begin, but we have a long way to go, and that's why we're here today ultimately. So if you ask this question, what is stopping Americans from living the longest lives they can? What are Americans' attitudes and beliefs about their health? And what is standing in the way of good health? Susanna has talked about that. It's why we're so excited to have established a relationship with the Pew Research Center and to work with Susanna on these issues, on these questions. We have to work with a number of investigators. We have to conduct market research. We have to use the techniques that companies do to understand the way that all segments of the population, different ages, different geographic regions, different ethnicities, different education levels, the way that they obtain information, so much of the compelling information that Susanna was talking about. We need to generate content, we need to analyze content, we need to work with the most important people who are studying these and design our own questions. We need to do our own ethnographic research to really get out into communities and hear how people are talking about these issues. This is just emphasizing what I've just said. We need to learn from past successes. So we heard from Kaya about the fact that some of the tobacco cessation programs have shown themselves, proven themselves to work. The crash test dummies have proven themselves to change the way that people started first with their attitudes and beliefs about the values and the proposition of wearing a seatbelt, and ultimately we know that in a relatively short period of time there was cultural transformation around seatbelt use. So we need to study these. This is kind of the work of Ellen Wartella can guide us in, being somebody who's really devoted her life to studying the impact of health media, what works, what doesn't work, why. And then we have to ask everybody in this room, the IOM, we asked this of the IOM and the CDC and the NIH, the Michael and Susan Dell Foundation and Kaiser Permanente, and before that, the other foundations who you saw with addiction and Alzheimer's. We have to ask you to respect the creative process, that it is in and of itself a rather difficult to define, ambiguous, and some would say, I would say, black box process. But the model that we have developed for a healthy America, building on the relationships that Harvey spoke about in the beginning, of working from an evidence base. It is taking the knowledge that has been generated, that has been vetted by the IOM, and steeping the people who will do the creative work, the team of the Public Good Projects, the major agencies, ad agencies, the greatest ad minds in the world who are going to come up with campaigns as successful as the crash test dummies, who will come up with schemes and creative ideas that will just forever be with us, whether it's tunes that we'll be singing or equivalent of crash test dummies that become iconic in our lives. We need to steep those creative people in all this knowledge. We need to learn from everybody in this room and everyone participating in this forum so that their source of inspiration is born out of the real struggles, the real challenges, the real fabric of the American culture, that they understand the weave of the culture. Megan talked about storytellers. This is our job. Our job is to find the best storytellers in the country. I tell the story on working on The Weight of the Nation, where we were profiling HHS's, CDC's, Communities Putting Prevention to Work, the CPPW efforts that was out of the Recovery Act money. And there were 17 cities that were granted CPPW grants. And so CDC as our partner, it was important that this campaign be a part of The Weight of the Nation. And so we eventually decided, along with the CDC and our partners, that the work that was going on in Nashville maybe had most cinematic possibilities. So we went down to profile the work that was going on down there. Mayor Carl Dean was putting a lot of additional resources into CPPW to supplement the federal grant. And we interviewed nurses at Vanderbilt Hospital. We interviewed firemen in the fire department. We interviewed a group of women in a call-in center for motels who sit all day long at their desk taking hotel reservations. And I went down with a set of expectations that the narratives that we were going to be hearing were going to mirror the narratives that the research that we had access to in the years prior to producing The Weight of the Nation. And so I had the expectation that when I would ask people about the obstacles to good health, that I would hear about the cabbage soup diet, that I need to go on the cabbage soup diet because that's what my friend lost weight on. Or I would hear about letting the gym membership lapse. And I think it must be 50, 60, 70 people that we interviewed. Not one comment of that nature was made. It was all about how it's not working for us anymore. The life that we thought was so good, that was giving us everything that we had hoped for, it's just not working. And that was a universal thought that was expressed over and over and over again. And it was so curious to me. And the reason I bring this up is that what was coupled with that comment was that, well, our mayor has, in a few short years, given us 120 miles of bike lanes. And our mayor has organized these walks where he invites the citizens to join him on these walks, and there are thousands of people going on these walks. And there was a collective understanding in the population of Nashville. And I'm telling you, it just was a mindset that was really consistent across all the groups that we met with, that the environment is not supporting a healthy life, and that the individual, is now being given the healthy choices. Their sidewalks have been put into the community so they can walk safely in the neighborhood. The bike paths have linked every neighborhood of the community so people can bike everywhere. And that's what they're starting to do, and they're weaving it into their lives. But coupled with that is that Carl Dean understood that you have to market that. You have to inform the population that the bike lanes are there and the sidewalks are being put in, and that this is good government, and this is what's good for the citizens is ultimately good for the health of the city. It will drive more conventions that will want to come there, more businesses that will want to come there. And so it was a brilliant opportunity for us to convey so many things in The Weight of the Nation, but it shaped our understanding of what are the collective forces that have to be engaged to transform the health of a community, and that it might not have reached this tipping point, which is what we seem to have landed on in that one community, of a collective understanding that it's not the cabbage soup diet, it's not the gym membership that's going to solve the problems. It is living in a healthy community where all your peers are sharing those values, and so you're going out walking together at lunch. So I tell that story, and then the final thing is in finding storytellers, we found a woman, because of the work that you have to do as filmmakers and storytellers. We found a woman who weighed 450 pounds, working at the Collins Center, single mother, with a teenage daughter who was herself gaining weight. And Gigi had an epiphany one day where she felt that all the sacrifices that she was making for her daughter by working 60 hours a week and making the easy choice of eating at McDonald's, etc., that was going to, in fact, deprive her daughter of her mother's presence in her life, that she was going to die prematurely. And so it was not the simple solutions that she had previously tried of the right diet and the search for the elusive diet. She realized that she had to begin moving. And the only option to her was in the parking lot of the corporate park that they worked in. And so she organized the other women in the office. It's a tough environment to spend the day in, and it's a challenging life to spend all day long immobile. Gigi's lost 200 pounds. 200 pounds. We write about her in the book. Just by walking at lunch in the parking lot. They go back and forth and back and forth in the parking lot. But it's those kinds, we have to do our job. We have to find the Gigis in the world who have an ability that when you turn the camera on or you turn the camera towards them, it's magic. So that's our job, because the Gigis of the world become the storytellers that inspire and shape the thinking of the public. We need to achieve ubiquity. I say this often, that the investments that the foundations that have joined us so far and the others that we hope will join us are making, if we don't achieve ubiquity, if we do not become ever present in the culture, and if we don't sustain that, then it's not an investment worth making. Because I can, with my teams, we can make fantastic creative product. I have no doubt in my ability to find the people and find the storytellers. But if we don't get it out there, and if we don't sustain it, it's not worth the investment in that wonderful creative product. We need to create a mighty coalition to market health. If we're going to market, as Phil Marino says, we're going to market the hell out of health. If we're going to do that, we have to have a mighty coalition of philanthropic support, corporate partners, institutional partners. The goal of a healthy America, if we are going to be as ubiquitous as we aim to be, if we are going to be sustained over time, we have to, and this is where Harvey and the IOM come in, we have to build an enormous table and invite everyone to the table to have this mighty coalition. We have to be current. You've heard about this from a few people. We have to start young. If we really are going to change the culture, we have to start young, and we have to stay in every future generation's lives. And we have to start with young adults as well, and that's going to be a challenge because, as Megan says, they are ahead of you all the time, and it's very hard to reach the young adult population and have them really want to hear from the man. We have to improve and always test, always measure, and we have to keep measuring, testing, and adapting. And Harvey is the one who started talking in our discussions about a culture of health, creating a culture of health. This is our aim, is to have a healthy America be what really drives the conversations, as I said at the beginning, in the home, with oneself, in the home, in the church, in the school, in the workplace, as you're driving down the highway, the billboards we see. This is our aspiration. This is our big, hairy, audacious goal. And I am the Public Good Projects with John and Allie and this wonderful board that we're building. And Harvey and everyone else at the IOM is our partner.
Thank you, John. I want to have one person introduce herself who just came in a few minutes ago. That's you, Jillian. Yes.
Being late. It was fun getting here. I ended up having to hop the train from New Haven. My name is Jillian Barkley, and I'm Vice President at the Aetna Foundation. Thank you for inviting me.
I'm glad you could join us, even though sounds like you got held up despite your best wishes.
Oh, yeah.
So, too bad.